I will begin by checking my patient's orders for a Foley catheter. Today my patient has an order. They have urinary retention. The next thing that I will do is gather my supplies, and I have a Foley catheter kit. I will enter my patient's room, wash my hands. I'm going to introduce myself to my patient and ask my patient to state their name and date of birth while checking their name identification bracelet. I also want to ask my patient, do you have any allergies to iodine or latex? No, you don't? Very good. I'm going to explain to my patient what we're going to be doing. Today we're going to insert a Foley catheter. We're going to place a tube in your bladder that will help drain your urine. Now I will pull the curtain for my patient's privacy. I will position my patient and examine her perineal area for cleanliness. I'm going to put on exam gloves. I want to put the head of the bed down. Mrs. Doolittle, are you comfortable lying flat? Okay, very good. Now I'm going to go ahead and get you in a position to put this catheter in. I'm just going to uncover you. I'm going to ask you just to move your legs to the side, provide perineal care if necessary. I also have an absorbent pad down in case there's any spills. Now I will remove my gloves, wash my hands, and set up my sterile field. I'm opening my outer wrapper away from me so that I'm not leaning over my sterile field. Everything on the inside of my package is sterile. I'm going to remove my sterile gloves from my container. I'm coming around to the side so that I can open my gloves and put them on in a sterile way without contaminating or touching my sterile field. I will place my sterile drapes to the side. This is a container for urine specimen, which I do not need. I will place to the side. This is my lubricant. And dispense into my tray. I will take my forceps and fluff my cotton balls so that I can separate them from one another. I will open my betadine and soak my cotton balls. For demonstration purposes, I will not use the betadine at this time as it will stain the mannequin. Now I want to check the balloon on my catheter. It is very important that I am careful when I handle my catheter, as it is sterile, and I do not want it to flip out of my container and become contaminated. I'm removing the outer wrapping from my catheter. This is the port that I will attach my syringe to with sterile water and inflate my balloon. This attaches with a twisting motion. I will inject all of the water into the catheter to test my balloon. Now I will allow the catheter, the balloon, to deflate. I also noted that there was no leaking from my balloon. I want to check the valve on my bag, on my drainage bag, to make sure that it is closed. This will prevent any leakage of urine. My fenestrated drape is for male catheterization, and I will not be using it at this time. So I will set it to the side. This is my sterile drape, which I will now place under my patient, keeping in mind that this is a sterile procedure, and at all times I'm keeping my hands sterile. They are above my waist and in front of me, and I'm not touching anything else. I'm going to fold my sterile drape, holding my thumb on one side and my hands on the inside, and turn the drape in so that my sterile gloves are protected and covered by the sterile drape. I now am going to place my sterile drape under my patient's hips and perineal area, protecting my sterile gloves. My hands remain sterile. Now I'm ready to move my supplies to the patient's bed. I will place my tray on top of my box and center it. Pick up my box and my drape and move it to the center of the bed, maintaining sterility. Now I will move my container closer to my patient. Now I am ready to prep my patient. Mrs. Doolittle, I'm going to go ahead and clean your perineal area with some betadine. It may feel cool. You're just going to feel my hand. Now I will cleanse my patient's perineal area with the betadine soaked cotton balls. I will begin by going down one side from front to back, only using each cotton ball once and discarding in the trash. I will go down the other side, front to back. Then I will go down the center, repeating until all of the cotton balls have been used. It is important that my hand, my left hand, hold the labia at all times and not let go until the procedure is complete. This is because my left hand is no longer sterile, and if I release my hand, the labia will close and the perineal area will no longer be sterile. I now will take the tip of my catheter and lubricate it in the lubricant on my tray, approximately 2 to 3 inches. Mrs. Doolittle, I'm going to insert my catheter. You may feel some pressure. Just take some slow, deep breaths, and we will be finished in just a moment. I will insert my catheter. I'm inserting with a continuous motion until I am able to see urine. I will continue to insert my catheter another 2 to 3 inches so that it is well into the bladder. Then holding my catheter, I will inflate my balloon. Giving my catheter a gentle tug to know that it is in place, I will then release my hand from the perineal area and disconnect my syringe. I can now take my drainage bag and position it on the Foley hook that is on the bed. Do not hang the drainage bag from a side rail. Cleanse the perineal area to remove the lubricant and betadine using a front to back wiping motion. You want to use a different part of the sterile drape with every swipe. Remove my gloves. Once I have removed my gloves, I will secure my catheter with a Foley leg strap. Wraps on the thigh with Velcro. It should be snug and not too tight. And then I want to secure my catheter. This will keep my catheter from pulling. I want to make sure that I'm leaving some slack with the catheter. Now I'm going to cover my patient and reposition for comfort. I'm going to put my bed in the lowest position. Now I'm going to wash my hands.